As a psychologist, I often encounter questions about the differences between life coaches and mental health therapists, including psychologists. While both professionals aim to help individuals lead fulfilling lives, their roles, training, and approaches are distinct. Understanding these differences is essential for choosing the right support for your needs. Welcome back to Savvy Psychologist. I'm your host, Dr. Monica Johnson. Every week on this show, I'll help you face life's challenges with evidence based approaches, a sympathetic ear, and zero judgment. Let's first look at the training and credentials. We'll start with mental health therapists and psychologists. Therapists, including psychologists, undergo extensive education and training. Psychologists typically hold a doctoral degree, which is a PhD or PsyD, and complete supervised clinical training, licensure exams, and continuing education. We literally have thousands of hours of training and supervision with patients prior to completing our graduate programs. Once our graduate programs are complete, we typically complete at least another 2,000 hours of supervised work experience in the form of a postdoc prior to being independently licensed. Therapists such as licensed clinical social workers, licensed professional counselors, or licensed marriage and family therapists also have graduate degrees and state licensure. They typically have about 900 hours of training and supervision prior to completing their graduate programs. There is more supervised experience that is given after the graduate program is complete, and the amount is dictated by the license type and state. Next, we'll look at life coaches. Life coaches may complete certification programs, but there is no standardized education or licensure required. Training programs vary, and some coaches have backgrounds in psychology or counseling, while others do not. Something to note is that anyone can call themselves a coach. It is completely unregulated. Now, let's look at the scope of practice, starting with mental health therapists and psychologists. Therapists and psychologists are trained to diagnose and treat mental health conditions such as depression, anxiety, trauma, PTSD, bipolar disorder, eating disorders, and more. They use evidence based approaches like cognitive behavioral therapy, psychodynamic therapy, dialectical behavior therapy, and EMDR for trauma. Interventions may include talk therapy, skill building exercises, exposure therapy, and mindfulness techniques to help clients manage and improve their mental health. Now, let's look at life coaches. Life coaches focus on goal setting, personal development, and motivation. They help clients clarify their values, set achievable goals, and create action plans. Coaches work with individuals who are generally mentally well, but seek support in specific areas like career growth, relationships, or lifestyle changes. However, they are not legally permitted to diagnose or treat mental health conditions, which is a key distinction from licensed therapists and psychologists. They are not treating mental health conditions. If they say they are treating your depression, anxiety, etc., then they are practicing outside of scope. Now let's look at the therapeutic relationship and approach, starting with mental health therapists and psychologists. Therapy often involves exploring past experiences, emotional patterns, and underlying psychological issues. Therapists provide a safe space to process complex emotions and work through mental health struggles. For example, if someone is dealing with anxiety from childhood trauma, a therapist would help them uncover and address these root causes using specialized techniques. Now let's turn to life coaches. Coaching is typically future focused and action oriented. Coaches encourage accountability, provide motivation, and offer practical strategies to achieve personal and professional goals. For example, if someone wants to switch careers but feels stuck, a life coach would help them identify their strengths, set a timeline, and stay on track without delving into deep emotional barriers. Even this distinction is blurry. There is basically nothing that a life coach can do that a therapist or psychologist can't do. However, the majority of what a mental health professional could offer you is not a service that a life coach could offer. Now let's look at confidentiality and ethics, starting with mental health therapists and psychologists. Therapists and psychologists adhere to strict ethical guidelines and confidentiality standards set by professional organizations like the American Psychological Association. These guidelines include safeguarding client information, maintaining confidentiality except in cases where disclosure is legally required, such as imminent harm, abuse, or court orders, obtaining informed consent, and providing competent evidence based care. They are mandated reporters for certain issues like abuse or harm and are legally bound to protect client welfare and privacy at all times. Now let's look at life coaches. Coaches also value client confidentiality, but they are not bound by the same legal and ethical standards as licensed mental health professionals. This limitation means that while they can provide guidance and support, they do not have the legal authority to address mental health conditions or guarantee confidentiality under the law, which may put client privacy at potential risk compared to the protections offered by licensed professionals. This is not to say that life coaches are dishonest at all. There are reputable ones. However, they do not have legal or ethical obligation in the way that healthcare professionals do. That means that they could disclose information and there would be little to no recourse. So, which one is right for you? Choose a therapist or psychologist if you are experiencing mental health issues, need support for emotional well being, or want to explore deeper psychological concerns. Choose a life coach if you're looking for guidance in achieving specific life goals, need motivation, or seek to improve performance in certain areas. Both therapists and life coaches offer valuable support, but their expertise and approaches cater to different needs. Therapists can provide all of the services that a life coach offers, including goal setting and personal development support, but also have the training and legal authority to diagnose, treat, and support mental health conditions. Life coaches, however, cannot provide clinical mental health services, making therapists the more versatile option for comprehensive support. It's important to assess your personal goals and challenges to make an informed choice. Now, let's talk about some of the potential red flags to look for with a life coach, as I've seen less information about this topic. When selecting a life coach, watch out for red flags such as lack of certification or training from a reputable program. For example, be cautious if a coach claims expertise without any formal education or recognizable credentials. Reputable organizations that certify life coaches include the International Coach Federation, ICF, Center for Credentialing and Education, CCE, with its board certified coach, BCC credential, and the International Association of Coaching, or IAC. Coaches certified by these organizations have met specific training standards and adhere to ethical guidelines. The next thing to look out for are guarantees of quick fixes or unrealistic outcomes, such as promises to cure anxiety or depression within weeks. This is a red flag because mental health conditions often require comprehensive, evidence based treatment over time, and quick promises may exploit vulnerable individuals seeking help. While life coaches without clinical training may oversimplify these challenges. Red flag number two, refusal to provide references or client testimonials, which can indicate a lack of successful past work. Because there are no outside regulating bodies for life coaches, client testimonials become even more important to verify their credibility and ensure you receive the quality of service that you're paying for. The next red flag are attempts to diagnose or treat mental health conditions, which is outside of a coach's scope of practice and can be harmful. Even if a life coach is also a licensed mental health therapist, in their role as a life coach, they are not permitted to provide mental health treatment, making it essential to understand the capacity in which they are working with you. The next red flag is poor boundaries or a lack of professionalism, like oversharing personal details or blurring the lines between personal and professional relationships. Another red flag to watch out for are high pressure sales tactics or hidden fees, such as insisting on immediate payment for long term programs without clear terms. Next is a lack of clear structure or a method in their coaching process, which can lead to unproductive sessions. This is especially important because without a structured approach, clients may waste time and money without making progress. For example, a coach who frequently changes focus or provides vague, non specific advice may leave clients feeling lost or frustrated. Even if a life coach is also a licensed mental health professional, in their coaching role, they must adhere to a coaching framework rather than therapeutic methods, which limits the type of support that they can offer. A credible life coach will be transparent about their qualifications, maintain clear boundaries, and refer clients to mental health professionals when needed. Always do your research, ask questions, and trust your instincts when choosing a coach or a therapist for that matter. What are some green flags that you've noticed when looking for mental health providers or life coaches? Let me know. You can contact me via Instagram at KindMindPsych or via my email at psychologist@quickanddirtytips.com. The Savvy Psychologist is a Quick and Dirty Tips podcast. It's audio engineered by Steve Rickyberg with script editing by Brandon Getches. Our podcast and advertising operations specialist is Morgan Christensen. Our digital operations specialist is Holly Hutchings. And our marketing and publicity associate is Davina Tomlin. Nathaniel Hoops is our marketing contractor. Follow Savvy Psychologist on Apple Podcasts, Spotify, or wherever you listen to podcasts. That's all for this episode of Savvy Psychologist. Thanks for listening, and I'll see you next week.